What we've built here is we're calling it the AWS Experiential Village. So it's an opportunity for people to kind of have a look at how tech is changing the way that healthcare is provided. What we've done in the village is we've tried to create different environments. So in the home of the future, we're showing how pretty standard domestic items like a fridge, a smart fridge, can be linked and stream, glucose data that's coming from a device that a patient's wearing, say a type 1 diabetic, and how that can help that individual manage their care.
12 years, I've been type 1 diabetic. I've only been wearing this sensor for probably the last 6 months, and already it's just given me the ability to see and understand what's happening with my diabetes in a way that was never possible before. I'd sleep all night, I'd never have any clue whether I was going up or down or whatever, and now I can see the whole thing all the time. I can share the site with my partner and my family, and they can see what I'm doing at a given point in time. I can send alerts to them when I'm going low, and they know where I am and what my number is. So the control that you can get from this is just like nothing I've had access to before. Alexa, ask my doctor what medications I'm on.
You have active scripts for fluoxetine, ibuprofen.
We're showing how you can use voice-activated devices like Alexa to interact with your health record, to maybe order repeat scripts, or even check in the kind of medication that you should be taking and get verbal prompts around that. The clinic of the future, what we're showing there is actually you can use voice to actually enable the conversation between the patient and the clinician to be the main thing in the focus.
Alexa, ask Ventures Practice to start a consult.
And then we're recording that in the background and then transcribing it and translating it into health data that we can stick into the record that the patient and the clinician have got direct access to.
Any other symptoms like a cough or a snotty nose or anything like that at the moment?
Well, the great thing about this is that this is really cheap. So we're running all of this on the AWS public cloud. So, we're using, massive global computing power. You only pay for what you use, so it's serverless. There's no infrastructure, you don't have to buy hardware. We've just got devices that connect to it. So if you don't use it, you don't pay. And then the devices we're talking about, an Alexa device is a $50 device. Some of the monitoring devices that we're talking about giving to patients are $100. Technology is bringing down the cost of a lot of these and making it much, much more accessible for people. Hospitals are in the business of managing illness. Primary care and community care is in the business of kind of keeping people well and keeping them away from hospitals. So, if we can keep people well, we can save the country money. I mean, the 20 district health boards nationally, $500 million in debt. The model's kind of broke anyway, so we need sort of a radical kind of change to turn things around.